month was Healthy Weight Week last week, so we're doing 2 this week. One with our Fresh Start program in Trish Bohr, and one on Thursday with Majori Gingrich, our dietitian. So we can find a way that helps people to get to their healthy weight and then maintain that as well. So this is our first seminar, and I'm going to introduce Trish Bohr. She is our Fresh Start coordinator here at the hospital, and she's going to talk to you about the ideal protein diet. So welcome, enjoy yourselves. You do have some paper in front of you, take notes. If you have any questions, you also have Trish's card at the end. So thank you for coming.
Thank you, Amy, for having me, and welcome to you guys. Appreciate you coming out and dealing with the wind and the weather, and taking time to come and learn about one of the hospital's new services. So, like Amy said, I'm Trish Bohr. I'm the Fresh Start coordinator. Our Fresh Start program sometimes is confused with other names that people talk about it around the community, are the hospital diet, or ideal protein. All of those things, when they're being discussed, are referring to our Fresh Start program here at the hospital. So we have recently been moved down to the Living Well Center, which is just here in the hospital, down past physical therapy. So I have a nice new office there with great space for that I can meet with individuals or couples at this point, so that's nice. So we're going to go over lots of different things today. Please feel free to stop me, ask me questions. The more informal, the better for me, and so don't be afraid to stop me if you have a question that you want me to cover. Some of the things we're going to go over are why the hospital would want to sponsor a weight loss program. And the difference is the fact that it's one option for people for weight loss and for weight maintenance. So part of why the hospital decided to do that is because, first of all, we can look around and know that our community as a whole really struggles with being overweight and with obesity difficulties. Obesity very much affects your health, and therefore very much affects your health care. So the hospital decided it would be a good service to offer the community to have a weight loss program. I do take referrals from a lot of the physicians in town, from Iowa City, from all over the area. But a physician's referral is not required to be part of the program, so I have both clients that are just interested personally in losing weight and those that their physician has asked to become involved with the program. So that's a little bit about that. What I do on a daily basis is I meet with clients individually, one-on-one, or sometimes as a couple, if a couple is deciding to take on weight together. And so we meet individually, we meet weekly. We go over a food log that they have kept. We go over any kind of upcoming triggers or hurdles that they can anticipate having. And then we help them make some food choices for the upcoming week, take measurements and weights, discuss how they're doing on the program, and send them on their way. So we do meet for about a half an hour individually each week. So some of the statistics, I won't go over a lot of that kind of thing because I think that we all see the problem around us. We get the fact that America is getting fatter and fatter, and how much that affects our health. But a couple of things I think that is really worth mentioning are 2 out of 3 American adults are overweight. The problem is becoming worse and worse. 1 in 3 U.S. children are overweight or obese. This is really interesting to me that $147 billion a year is spent by insurers on obesity-related health care. It affects so many different things that it really makes a rippling effect in people's health care. And you can see the bottom one there, 40% more health care dollars are spent on people that have obesity issues than those that don't. So part of that is a good reason why the hospital would want to have a weight loss program that they sponsor and support. I do work closely with my clients' physicians. It's required that I have a family physician on record and I share their lab results with their physician. and always send an initial letter with their physician to let them know that they're participating and asking to keep the communication open if there's any medications that need to be adjusted with weight loss or, that type of thing. So my background is not in healthcare. I'm a coach type position, so it's important to me that my clients know that I don't want to make healthcare decisions for them by any means. And if I have a question, I have a huge support staff here, support network here at the hospital, as far as getting questions answered with what to do with someone's, that are having this or that sort of feelings physically or complications. Then we talk with their own physician or with one of the physicians or nurses here on staff. So what has changed? Why are we having such an obesity climbing issue in North America? Part of it is one of the major culprits is sugar. And when I say sugar, I mean carbohydrates in general. So both simple carbs, complex carbs, all carbohydrates. One of the most important things regarding the Ideal Protein protocol for you to remember is that all carbohydrates, regardless of their form, eventually become sugar and are processed like sugar in your bloodstream. So that's an important piece of information as far as how the Ideal Protein program works. Why is the problem growing? Well, let's take a look at this. In 1905, North Americans ingested about 5 pounds of sugar apiece a year. So in 2013, any guesses? It's on your material, but if anyone has any guesses on how many pounds of sugar are ingested in 2013 on the average, let's just say it more than doubled, tripled, quadrupled, 150 pounds to 200 pounds of sugar. So that's staggering, isn't it? I mean, we are living farther and farther from the earth. That's a scary thought to me. I mean, why? Why is it such a problem? And this is just my opinion, but I think 2 really important reasons. I think it's how we spend our time, and it's how we eat. And when I say how we spend our time, I mean we're all trying to get too much in a day. We're working 2 or 3 jobs to keep up with the commitments that we've made. We are having to pack more and more and more in a day, and so we spend less and less time with real food, with people don't garden nearly as much as they used to. We're lucky if we get to a farmer's market, that kind of thing. We stand in front of the microwave and tap our foot. I don't have 3 minutes for this meal. So I really think that's a big part of the problem. And again, that's just my opinion, and I'm guilty of it like everyone else. We try and pack too much in a day. So, and the food that we eat. We eat food driving a car. We eat food in front of the TV at our desk in a meeting. Here we are, we're trying to pack a lot in a day. And so it's the food that's fast. It's the highly processed food that keeps and that's fast. And I think that has really contributed a big part to the problem. 2 things, quick lesson on how Ideal Protein, how the science of Ideal Protein is different than a lot of other weight loss programs that I have been familiar with. 2 important things about that: metabolic syndrome and hyperinsulinemia. Both of these things are a result of our body. With the standard American diet, we eat a lot of carbs, our blood sugar spikes, our pancreas kicks in to bring your blood sugar down. It makes too much insulin. The extra insulin stores as fat, your blood sugar drops, and you crave carbs again. And this becomes a vicious cycle. So it takes more insulin to adjust our blood sugar, and our excess insulin that we're making is being stored as fat. And so what happens is our pancreas is just working and working and working to try and bring our blood sugar down. All four of the four corners here are all major symptoms of metabolic syndrome or syndrome X, abdominal obesity, high cholesterol, high blood pressure, and high blood sugar. Ideal Protein feels like all of these things are very much connected to your diet. So by treating the sugar, the overactive pancreas, the sugar insulin problem, we're able to see a lot of these symptoms be relieved by people getting off of the sugar temporarily. All of the carbohydrate types of foods, there are carbohydrates included in the Ideal Protein diet, but they're very controlled amount of carbohydrates. So by depleting our carbohydrates, our body is able to relieve a lot of these symptoms alone. So that is a big part of how the science of the Ideal Protein is different than a general, more balanced, reduced calorie diet. So how we address the overall problem. With Ideal Protein, we know that our body can get energy from all three of these sources. From your glucose, which is your sugar or your carbohydrates currently in your bloodstream, from your stored muscle, and from your stored fat. What we do at Ideal Protein is we reduce the sugar intake, the carbohydrate intake, which allows your body to burn through the glycogen that's currently in your blood. Once that's depleted, your body then must choose between burning stored fat or stored muscle. We insulate the stored muscle by using highly bioavailable protein foods. So the foods that we provide with Ideal Protein are very easily broken down, first pass through the liver. They are average about 100 calories for 15 grams of protein. So people are surprised to realize how they don't get hungry, because they're not spending nearly as much time eating the volume that they were accustomed to, but the amount of protein, which is not a high protein level, but a moderate protein level with low fat and low carbohydrates, and they're able to be satisfied. So what happens is, with the absence of the glucose, the muscle is insulated, and your body then will turn to burning stored fat for energy. So if you have noticed friends or coworkers that have reached their goals, health goals, fairly quickly, lots of times that's what happens with people that are following this program. That also makes it pretty rigid as compared to a reduced calorie, more balanced diet. We would think of moving from a standard American diet, we would think a slice of pizza and a nice big lettuce salad is a great choice for lunch. On the Ideal Protein protocol, that wouldn't work so well because you're reintroducing the carbohydrates. And temporarily, we want to reduce those carbohydrates in order to stay in your fat stores. So, any questions about how that process works differently than others? On many diets, and when I say that I mean kind of the typical balanced diet, reduced calories, we see people that will absolutely be able to lose weight because they're losing weight based on reduced calories. They lose water weight, fat, lean tissue, and muscle as well. So our goal is to insulate the muscle, lose the water, lose the stored fat, and retain the muscle in an effort to keep the calorie burning vehicle maximized. So again, on most diets, if we lose 20 pounds, approximately 10 pounds is of fat and 10 pounds is of water, lean tissue, and muscle. Unfortunately, if we regain the 20 pounds, which many of us have done, myself included, we don't regain the muscle. Typically, especially as we get older, we lose, that's part of the trouble with the yo-yo dieting, we lose muscle each time that we've lost weight. And it returns more quickly because we don't have the muscle mass to burn the calories as we did in the first place. So we end up in worse shape than we were in the beginning. So this is more information regarding reducing the food groups across the board. At Ideal Protein, again, we believe that it's important to retain the minimum amount of protein you need to retain your muscle. So this is another picture of showing side by side the standard American balanced diet, the hypocalorie diet, the reduced calorie version of the balanced diet, and then the Ideal Protein diet. So if you'll notice in the colored strip to the right of each of those columns, the vitamins and minerals are retained up at the normal recommended amount in the Ideal Protein diet. The carbs are greatly reduced. The fat is also reduced, and the protein is based on the minimum amount of protein that we need to have our vital organs function well.
Trish,
Yes.
because of the low number of calories that you're taking during phase one, does it diminish like your energy levels?
We don't find that it does. There's a short period of time that sometimes people will go through as you're detoxifying and coming off the carb withdrawal, that you can feel sluggish. That usually passes in the first week. I more often hear that people are surprised that their energy level has increased. So, and I would have thought that too. We know of carbs as what gives us fuel and what gives us energy, but it also gives us the blahs. You know, the spiking and dropping blood sugar also kind of gives you that 2 o'clock afternoon dump sometimes that you feel after having a lunch that's full of carbohydrates. So,
And can you talk on the fact of how do you keep your vitamins and minerals at the same level as a balanced diet if you decrease the amount of food
sure,
that you're eating?
absolutely. We have required supplements that are formulated specifically to go with this program. So not only do you get food from the Ideal Protein program, but you also have a regimen of specific supplements that are required. So oftentimes we'll have people say, I already take great multivitamin, can I continue that? And unless it's something that their doctor has prescribed, then we ask that they use ours, because you're temporarily not eating all of the food groups. And it's important that you get the nutrition from the food groups. So sometimes when people don't have all of the information, they jump to the conclusion that that it can't be a healthy program, or that it is a fad type of program because it doesn't include a balanced diet. And we're purposefully temporarily tipping you out of balance in order to get into the fat stores, and then returning you back to a balanced diet. And there's a beginning and an end. There are 4 phases. You have the weight loss phase. You transition to re-enjoying the good carbohydrates after you've reached your weight loss goals. And then there's a maintenance phase to keep the weight off. So one of the other things that is, because there's a quick weight loss, sometimes people are concerned that that means it's not a healthy plan, or sometimes people are of the feeling that slower is better. So you lose all this weight really quickly and then you stop and you gain it all back again. There's a maintenance program, and like anything else, it's not a vaccine. It would be nice if we had a vaccine for obesity, but it's not. In the same way as if you lose weight because you take on a great diet and exercise program, if you stop it and you go back to your old habits, the weight will return. But one of the really neat things I think about Ideal Protein is that once you're part of our clinic, once you're a member, you're always a member, and there's not an additional charge to come back. We encourage people, we plan ahead to have those people in maintenance come back. say after the holidays and you want to schedule yourself to check back in and lose the 5 or 7 pounds that you gained over the year or through the holidays, it's part of the program. So it's not a feeling of, here I go again. You know, it's scheduled, part of the program. You get right back on, you reset your pancreas. Your pancreas is then able to process the carbohydrates better that are coming in, and it's all part of the health care system versus bouncing on and off the program. So, and for people that have followed that, I have had really good luck, you know, as far as keeping weight off. It's important that we keep the relationship so people don't feel badly about coming back in and continuing to get support. So we talked about this a little bit, but you know, the 2 contracts with weight loss, and we all know that losing weight is the easy part, keeping it off is the difficult part. It's the ongoing forever thing, and our bodies are made to store fat. Our bodies are geared to store fat. It's the whole hunter-gatherer thing. It's part of the way we're made. So as long as we know that that's part of the system and that we just need to check back in and get back on track before things get out of control again, then it's not a problem. So. Any other questions? Is there anything else we can?
Tell me what protein, in general, what a protein, let's say diet, but what are you eating or not eating?
What does a day look like? During the weight loss phase, Ideal Protein has, like I said, we have some of our own foods that are packaged by the individual serving. And that's done not just because of portion control, but because I can help you get 15 grams of protein in for 100 calories versus 300 calories of boneless, skinless chicken breast, for example. So breakfast, Kevin, is an Ideal Protein food. We have things from drinks to omelets to pancakes, a whole variety of things, 70 or so different food options. So breakfast is an Ideal Protein food. Lunch is another Ideal Protein food, plus 2 cups of vegetables, and lettuce salad if you choose to as well. And then supper is 5 to 8 ounces of lean meat, 2 cups of vegetables again, and unlimited lettuce again if you choose to have that. And then you have an Ideal Protein food again between supper and bedtime as a snack. So we burn most of our calories during our REM sleep. So it's important that we insulate your muscle one last time before you go to bed. So
Are you cutting out bread completely or just?
you are.
Okay.
You are during the phase 1.
Okay.
And part of why that is because if you had bread, your body then is going to stop burning your stored fat
Okay.
and start burning the bread. And again, it's a temporary imbalance. So that would be true of an apple as well. You know, that's a very God-made, wonderful food, and it's absolutely not going to make you gain weight, but it will keep you from burning fat.
Okay.
So temporarily, we tip your body out of balance until you have burned the amount of fat to be where you want to be health-wise, and then we tip you back into balance, reboot the pancreas, so it's making the adequate amount of protein to handle the carbs that are coming in, with training along the way to be certain that you're getting training about making good carbohydrate choices, you know, after we have completed the program and you go on to maintenance. So.
How long are the different phases? Because you said there's 4 phases.
There are,
right?
yeah.
Or does
right.
it just depend on each person and their goals?
It can depend on each person, yeah. Phase 1 is where you are until you reach the goal weight or goal fat percentage, whatever you're basing your goal on. So women in our clinic historically have averaged 2.5 pounds a week to 3 pounds. So if someone took the amount of weight they wanted to lose, divided it by that number, that's about how long they would be in phase 1. Then phase 2, we introduce a few more calories and a little bit more fat, and that's just 2 weeks. And phase 3, we introduce a breakfast that has all food groups represented to re-engage the pancreas, so the pancreas is then kind of being rebooted in order to make the right amount of insulin, and that's 2 more weeks. So after that, then you're on phase 4, which is maintenance, and that goes on, indefinitely. And I still meet with people in maintenance if they want to come. They're not necessarily needing to be buying any of the ideal protein food at that point. Some people do because they're great snack choices that are healthy snacks, but it's not required.
I have a question.
Yes.
How do does anyone qualify, or do you have to be do you use BMI or some sort of qualification to be so much overweight?
You don't have to be, as long as your goal is still in the healthy BMI range. I've had people that have joined the program at the top end of normal because they're heavier than they have been in years past and are uncomfortable with it. In the same way that someone who's more on the really obese side would watch carefully to be sure that they're staying in a healthy range and in skeletal muscle, body fat, and BMI. So there are a few health conditions that don't work well with the program, very few. There are some things that would require a doctor's waiver for people to participate, but other than those, most anyone that is wanting to attain a healthy weight is eligible. So. Anything else I can answer? Okay. Well, my card is in your folder. If you have any questions, feel free to call me, and we can